Hi, this is Louis Mehl-Madrona. This is session 4 of Medical Aspects of Ceremony. Today we'll be talking about the medical aspects of the inipikaga or revitalization ceremony, formerly known as the Sweat Lodge by the Jesuits, whose name we're trying to change. But we'll also consider some aspects of the Hamblechia and the Sundance because some of the medical aspects will overlap. So happy to have you with us. And I'm going to review some pictures of the Inipi ceremony or revitalization ceremony, also sometimes called purification ceremony, though the better translation is revitalization. And as we've already discussed, it's a small covered structure made out of willow saplings into which hot stones are placed. Water is poured on the hot stones. Songs are sung, prayers are made, and revitalization occurs. So, and just some more pictures to give you a sense of what we're talking about in case you're just tuning in today and haven't been present for the 3 previous lectures. This is a smaller structure. This is actually a Chumash lodge because the Chumash put it together for smaller groups of people each time they do it and take it apart immediately. Whereas on the prairies, it's more common to leave the structure in place. Here's a painting of some women covering the kaga, the ceremonial structure in Alberta in the 19th century. Here's a nice picture in which you can see the stones in the middle of the pit. We're not always so lucky to have a wonderful skin on top of the lodge as this one does. And that's very beautiful. And you can see that it hasn't changed much over time. This is an Edward Curtis photo of some Lakota men engaging in an inipikaga in the 19th century, and it's pretty much the same. This painting was also done in the 19th century. So mostly today we use tarps because we can't afford skins, but bison or bear skins are expensive. And this is the pit where we heat the stones, or the ina, as they're known, and in order to bring them into the lodge. You can see the altar between the fire pit and the door, and you can see a V structure here for holding the pipe, the chanupa, the vesicle through which the prayers cross to where Creator sleeps at night. This is Edward Curtis again. This is a ceremony from the 19th century. It just looks a lot like today, as you can see. So, moving on. So I thought it would be really useful to contextualize this. And as of 2000, Buckwall found that a full 70% of urban Native Americans and Alaska Natives use traditional healing. On the Dene Reservation, Kim and Kwok found in 1998 that 62% of Dene patients had used traditional healers, and 39% did so on a regular basis. People use healers most frequently for arthritis, abdominal pain, anxiety, depression, and chest pain. So it is common. So we'll talk a little bit about heat today. Heat is important, and especially with global warming, heat is becoming more important because each summer, it seems like, is hotter than the summer before, And each summer now is becoming the hottest summer in history. And so we're encountering some problems that our ancestors didn't have, which is this whole difficulty with global warming. Now we know that heat is a health hazard, that it reduces human performance and work capacity. And this is already especially common in tropical and subtropical areas. And of course, many of the climate change impact analyses ignore the effects of heat exhaustion and reduced human performance on economic outcomes. So we're looking at heat stress. Heat received in excess of that which the body can tolerate without physiological impairment. Heat stress comes from three factors. It comes from the heat produced from muscular physical activity from inside the body. It comes from external heat outside the body, and it comes from clothing that affects the that affects sweat evaporation and heat convection. So external heat matters because it influences the rate of transfer of intra-body heat away from the body. So in hot conditions, when heat transfer is limited, the core body temperature increases, which can result in serious health risks. So, so we talk about this heat increasing metabolic costs while reducing exercise tolerance and work capacity. Now, by the same token, reduced hydration, which has been called hypohydration, also induces physiological strain, which is defined as increased core temperature and heart rate, while at the same time reducing the potential for evaporative cooling through sweat. The physiological effects of heat exposure and hypohydration have been studied independently and in combination with classic studies showing a proportional relationship between the percent of dehydration achieved during exercise and the cardiovascular strain and elevated core body temperature experienced. Mild dehydration is defined as about a 2% body mass loss, and even this has been shown to impair attention and psychomotor skills, as well as to negatively impact mood, perception of task difficulty, and concentration in women. Mild dehydration adversely affects vigilance, working memory, and tension anxiety in men. And of course, this is well known in the Sundance environment. We call it Sundance head or something similar. And this is why the dancers have helpers who are remaining clear-headed to guide and direct them, because they're not always able to do it themselves in relation to some degree of dehydration and cognitive impairment, and potentially also the effects of heat. So we know that elderly people and people with impaired health are especially vulnerable to heat. But heat stroke also occurs among young, healthy workers who perform heavy labor in hot conditions. And so there are heat stroke deaths occurring among agricultural workers in the United States, about 30 deaths each year. And it shows that people can ignore the symptoms of serious heat strain and continue to work beyond a safe heat exposure level. This is why, of course, in the Sundance, the helpers keep an eye on everyone to make sure that they're safe. So there are hundreds of cardiovascular deaths each year among construction workers in Qatar, which is quite hot. And this, of course, is probably due to workplace heat. During the 2 weeks of extreme heat that occurred in France in August 2003, more than 1,000 additional deaths as compared to the same weeks in preceding years occurred among people in ages ranging from 20 to 70 years. So heat matters. And most of these deaths were among men, which suggests that the impacts may have been at least partly due to excess heat exposures during work. During this same heat wave in all of Europe, as many as 70,000 heat-related deaths may have occurred, but no analysis of the occupational health component was conducted. So this is also linked to acute kidney injury and fatal chronic kidney disease. So in recent years, the epidemic of fatal chronic kidney disease in sugarcane harvesters in Central America has been linked to daily dehydration due to excessive sweating in the hot work environment. Now, we can talk about a measure called WBGT, which is a measure that combines within a single index temperature, humidity, wind speed, and heat radiation, all of which affect rates of heat transfer from the body. So when the hourly WBGT exceeds 26 degrees centigrade, hourly work capacity is reduced in heavy labor jobs, and above 32 degrees centigrade, any work activity is difficult. And this would, of course, transfer to dancing in the sun dance in these same conditions. So here's a framework for the cause pathways for direct heat effects on working people. And this would include dancing people. So we have external heat exposure and internal heat production producing heat stress. Heat strain produces both physiological changes and psychological changes. Physiological changes can result in clinical damage to organ function. Psychological and physiological changes can result in diminished human performance capacity. So some of these organ functions include acute heat stroke, subacute or chronic kidney disease. Some of these diminished human performance capacity items include reduced physical activity capacity, increased accident risk, and reduced work capacity. Acute heat stroke can lead to heat stroke disease and death. Subacute or chronic disease can lead to disease and premature death due to long-term excessive heat exposure, though that's not so much a concern for the ceremonies that we're talking about. So reduced work capacity leads to reduced activity and potentially increased risk for accidents. So here's some grid cell specific monthly average wet bulb globe temperatures. This is the WBGT index, wet bulb global temperature. Maximum in shade levels in the afternoon in the hottest month of each area from 1980 to 2009. And you can see that for the most part, in the places where Sundance is taking place, we're in the low risk region. Now, I do know of one Sundance in Arizona, which is done typically in March or April to avoid the high risk conditions that can exist in Arizona in the hottest months. And I have also heard of Sundances being done in Texas, which is an area considered at high risk for heat stroke. So these are things that we have to keep in mind and continue to understand that these areas of high risk or extreme risk will rise with global warming, that the latitude at which we achieve high risk conditions or extreme risk conditions will increase. So, so as little as 20% of metabolic energy used by muscles contributes to the muscular external work output. The remainder of energy use becomes waste heat and needs to be released from the body into the external environment if a rise in the core body temperature from the normal 37 degrees is to be avoided. Muscular movement is the major energy consumer in the body. And at high air temperatures, say above 34 to 37 degrees, the only method of heat loss is evaporative cooling via sweat. Now, you can see that's not such a problem in the inipikaga, but can become a problem in the Hamblegia and even more so in the Sundance. Let's see. Good. So this is an interesting paper that looked at deaths during the 2009 heat wave in Adelaide, Australia, that can help us to understand some of this. And of course, having pre-existing heart disease increased the risk of dying. And I think that's why we need to be cautious with people who wish to Sundance or undertake the Hamblegia who have pre-existing chronic heart disease. And interestingly, belonging to a community and participating in social activities more than once a week was protective against the effects of heat on physiology. Here's another study looking at heat exposure and diminished hydration affecting exercise capacity. So they studied 12 males under conditions of normally hydrated temperature, decreased hydrated temperature, normally hydrated hot temperatures, and decreased hydration hot temperatures. Exercise was 90 minutes of treadmill walking on a 5% grade while carrying a 20 kilogram rucksack. They used the profile of mood states and the scanning visual vigilance tests pre and post exercise. So the separate effects of heat exposure, this is the normal hydrated hot condition, and the diminished hydration temperate condition were similar. And the effects of the diminished hydration hot condition was far greater. So, so I guess that's obvious in a sense, is that diminished hydration and hot conditions will have a much greater impact on physiology than anything else, any of the other three cells. And they said that the heart rate increase per 1% body mass loss for underhydrated hot conditions versus normal hydrated hot conditions was 7 beats per minute, compared with the underhydrated not hot condition, which was 3 beats per minute. So though this was not statistically significant, presumably because they only had 12 subjects. So low hydration hot condition induced greater mood disturbance post-exercise compared to the other conditions. No differences occurred in the visual vigilance test. Independently, heat exposure and diminished hydration induce similar physiological strain during exercise. When combined heat exposure with diminished hydration, there was a synergistically exacerbated effect on physiology and mood. So, here's another paper that looks at the effect of daily mean temperature on um, heart disease mortality from ischemia, arteriosclerosis in China. So they found that in the Hubei province in China between 2009 and 2012, low temperature was associated with increased risk for a heart attack, which is ischemic heart disease, and cold effects lasted for several days. They did not find an effect from high temperature, but then again, maybe their high temperatures were not that high. So here's another paper from the International Journal of Hygiene and Environmental Health, and they talk about short-term departures from an optimum ambient temperature being associated with increased risk of out-of-hospital cardiac arrest. Uh, they found a V-shaped relationship between the preceding average 24-hour and 1-hour air temperatures and the occurrence of cardiac events. So they found an odds ratio of 1.5 for each 5 degrees below the optimum temperature, meaning that your odds of having a heart attack increase by a factor of 1.05 for each 5-degree drop below optimum temperature, but also 1.05 for each 5-degree rise above optimum temperature. So up or down both have the same consequences. And they noted that temperatures above the optimum were confounded by the effects of ozone, which is a very real consideration. Now, we've been talking about heart disease, and what about diabetes? So, and of course, we're looking at studies that could relate to participation in ceremonies, because no studies have been done on participants in ceremonies, and perhaps will never be done because of the nature of ceremonies and participation. But we can take lessons from studies done in other areas to guide us. So this is a study of diabetes in athletes. And we have to take into account people with diabetes have more difficulty regulating their heat than people without diabetes. And this can increase the risk of heat stress during exercise in hot or humid conditions like the sun dance. Um, so, um, so we'll come back to that, but a quick break to look at temperature variation and mean daily temperatures in 6 cities with different climates, looking at the relationship between mean daily temperature and mortality. The cities were London, Madrid, Stockholm, New York, Miami, and Houston between 1985 and 2010. So all cities showed a substantial increase in mortality risk associated with mean daily temperature, with relative risks reaching 1.428 for heat in Madrid and 1.467 for cold in London. So as temperature rises in Madrid, you're 1.428 times more likely to die, whereas in London, as temperature drops, you're 1.467 times more likely to die. So temperature has an effect. What about menstrual cycle effects? And of course, we have to take a brief digression to talk about menstruation and ceremonies. And having worked with women traditional healing elders and male traditional healing elders, I can say that there's quite a variation among policy. I've seen the more common situation is that women who are bleeding are prohibited from ceremony. But I have also seen women traditional healers bring in women who are having bleeding problems and sit them on sage and do healing activities within the lodge um, for the women. Now, often these are women-only lodges, and and but sometimes more, sometimes mixed lodges. Now, I think I've never seen anyone dance. I've never seen a woman dance the sun dance um, when she's menstruating. So that seems to be uniform. And and so that brings up another question about which I actually don't have slides because I just thought of it, and probably we will get some slides shortly. But what do we say when women come to us and say, "I want to go to ceremony, I want to Sundance, I want to do these various things. I want you to stop my period." Now we know how to stop the period. We just give a shot of Depo-Provera, and it stops. But is that ethical and desirable to do so for in order for someone to participate in ceremony? Well, we do it for birth control. So each of us, of course, has to decide what we think about this. But it is an increasingly common request among women who understand that if they have their menstrual period during the Sundance, they'll have to go to the Moon Lodge and leave the Sundance grounds. Their solution is to suppress their menses with something like Depo-Provera. Well, the good news about menstrual cycle effects is that pretty much there aren't any. So that's good to know. So what about diabetes? Exercising is more complicated for people using insulin. This is due to the potential for muscle contractions to promote blood glucose uptake separately from insulin, which can lead to hypoglycemia. And people with type 2 diabetes who don't require insulin injections each day have to still balance many factors to perform well. Now, here are some of those factors. Environmental factors include heat, humidity, cold, altitude. Bodily concerns include physical and mental stress, nutritional status, hydration, muscle, liver, glycogen levels, menstrual cycle phase, exercise, the type, mode, intensity, duration, frequency, timing, etc. of exercise plays an impact. So all of these are important for glucose control. So the type, order, timing, and duration of physical activities can impact blood glucose responses, and participation in aerobic activities can result in widely varying blood glucose responses. So we have to adjust insulin to prevent both hypoglycemia and hyperglycemia among people with diabetes. Okay. So hydration and electrolyte status becomes especially important in diabetes, and it's affected by elevated blood glucose, and also by the medications prescribed for people with diabetes, all of which can affect performance. So here's an interesting paper, which is from the People's Liberation Army Professional Committee of Critical Care Medicine regarding standardized diagnosis and treatment for heat stroke. So they say that heat stroke is a life-threatening disease characterized clinically by central nervous system dysfunction and severe hyperthermia with core temperatures rising higher than 40 degrees Celsius. The unchecked rise of body core temperature overwhelms intrinsic or extrinsic heat generation mechanisms and thus overwhelms homeostatic thermal regulation. So elevated temperature causes cellular and organ dysfunction with progressive exacerbation, leading to multiple organ failure and death. So we're talking about the effects of hyperthermia, which cause cellular and organ dysfunction with progressive exacerbation resulting in multi-organ failure and death. Now, a lot of what I'm saying is extreme in relation to the Sundance, but it's a range and it helps us to understand the risks and to anticipate them. The treatment for hyperthermia is rapid cooling to reduce core temperature as quickly as possible. This is the primary and most effective treatment, as it has become shown that the major determinant of outcome in heat stroke is the degree and duration of hyperthermia. Now, I have seen people pulled off the dance grounds and drenched with cold water and cold towels placed over them to bring their body temperature down. And I have seen this be successful. So this is something that happens. And if it's delayed, the fatality rate will be elevated. Now, I am unaware of any deaths from occurring during ceremony, but it could happen. And I think we have to maintain the belief that it's unacceptable for anyone to die during ceremony, and that it's incumbent upon all of us to do what we can to prevent that and to err on the side of early intervention as opposed to intervening too late. And so I would say for the most part, elders manage this really well. But we are seeing younger and younger Sundance leaders with less and less experience. And there is a core group. Well, let me not use the word core group. There is a group, just a group, within ceremonial circles who do not believe in intervention during ceremony, who believe that if the Creator means for you to die during ceremony, you should die. Now, this is a really interesting notion because I'm going to go out on a limb here. I could be criticized for this, but I guess I'm used to it. My reading of the literature on Sundance, especially that written by Walker from the 19th century, is that this was not the belief of the 19th century. Walker continually says that the dancers were given whatever medicine was needed to keep them dancing. And there are no reports of any adverse events coming from Walker or from anyone else in the 19th century. So this idea of Creator meaning for things to happen appears to me to be a Christian import. That the notion of sundance, the notion of all of these ceremonies, is connection with spirits, entering into a space between the worlds, but not crossing over. And in the 19th century, warriors had to be ready to get up and fight if the enemy appeared on the ridge above the dance grounds or the ceremonial grounds. And one couldn't afford to lose good warriors. Everyone was needed. So I think we have to debate this notion that some people have that if creator means you to die, you'll die. Because I personally don't believe it's traditional. In traditional understanding of the spirit-human relationships, we are intimately involved with many spirits, but creator is very far away and mediated our relationship to creator, mediated through other sacred beings, and not necessarily one of direct knowledge of creator of us. And this notion of things being meant to be, which is really a notion of linear, finite time, is also not traditional. That traditional is more circular, non-finite time, without a deterministic universe. So that's my argument that it's not. We're not dealing with fate here. We're dealing with we need to be dealing with common sense to prevent casualties. So I've already said that rapid cooling is the most important treatment measure, and fatality rates are related to how long people remain hot. Delaying cooling increases fatality rates significantly. So the treatment is cooling. Quickly cool the core temperature to 39 degrees or below within 10 to 40 minutes and to 38.5 or below within 2 hours. So how do we do that? Quickly move the patient from the hot and humid environment to a shady, breezy place. Make the patient lie down and remove all clothing. Use a cold water spray or wet towels to wipe the entire body. Use fanning to accelerate evaporation and convection cooling, and continue to monitor body temperature. So, what does heat stroke look like? Well, people get restless and twitchy. And the on-site treatment for someone with severe heat stroke would be 10 to 20 milligrams of intramuscular Valium. So, what is the heat index? The heat index is a numerical value obtained by a mathematical operation using temperature and humidity levels. The heat index positively correlates with the rate of onset of heat stroke. So when the heat index is greater than 41, the heat stroke onset rate increases. When the heat index is greater than 54, heat stroke is extremely likely to occur. So here's a table that relates relative humidity and temperature to the heat index. So you can see that even at a relatively mild temperature of 32 degrees, that in 100% humidity, you're in extreme danger of heat stroke. So, and the lower the humidity, the higher the temperature can go and still remain in below the danger zone for heat stroke. So this is perhaps a useful table to carry into the field to anticipate difficulties based on humidity and temperature. So pre-sunstroke occurs when we have headache, dizziness, thirst, sweating, sore and weak limbs, lack of focus, and uncoordinated movement in a high temperature environment. Body temperature may be normal or slightly elevated. If the patient is moved to a shady, breezy place in a timely manner to cool down, recovery occurs quickly. So what about mild sunstroke? So body temperature that is often higher than 38 degrees and may be accompanied by a ruddy complexion, excessive sweating, burning skin, the appearance of clammy and cold limbs, pale complexion, falling blood pressure, and accelerated pulse rate. This is the person who needs to be moved to a shady, breezy place, needs to lie down, get undressed, cool down, and replenish water and salt intake. So, associated with the sodium loss that may be going on, people can get heat cramps, which are temporary intermittent muscle spasms. Heat cramps happen to people who, upon initially entering a high temperature environment, sweat excessively and replenish only water intake, or don't replenish at all. So, heat cramps can sometimes be confused with the twitching of the hands and feet caused by hyperventilation during heat exhaustion. So, this heat exhaustion phenomena presents with cramps in the hands and feet and numbness in the extremities and around the mouth. So, treatment is based on quickly moving people to a shady, breezy environment to lie supine and replenish water to relieve the heat cramps. We obviously don't want people to become so extremely affected that they have to be transferred to hospital, because that would bring investigation to bear upon us, most likely by government authorities, and that would be bad. So an ounce of prevention is worth a pound of cure. So continuing to talk about heat exhaustion, these are the clinical syndromes characterized by decreased volume after heat stress. Too much fluid and sodium has been lost. Electrolyte imbalances occur. Clinical presentation of heat exhaustion, sweating, fatigue, weakness, vertigo, headache, poor judgment, nausea, vomiting, sometimes muscle cramps, orthostatic dizziness, and fainting. Body temperature is elevated without apparent damage to the nervous system. Heat exhaustion can progress to heat stroke if not treated timely. So again, treatment principles, rapid cooling. And of course, we don't want to correct hypernatremia too quickly because of the risk of cerebral edema, but we don't really think about that so much in the field. So heat stroke, the classic manifestations are high fever, lack of sweat, loss of consciousness. Exertional heat stroke is associated with fever, headache, dizziness, slow response or sudden collapse, and unconsciousness accompanied by nausea, vomiting, shortness of breath, etc. A rapid increase in body temperature to 40 degrees or higher follows, and delirium, lethargy, and loss of consciousness can occur. Patient's skin is hot and dry and the complexion is ruddy or pale. Patient begins to sweat excessively or break out in a cold sweat, followed by no sweat, tachycardia, shock, etc. We can see severe rhabdomyolysis or breakdown of muscles at the outset of a heat stroke. This can cause acute renal failure, acute liver damage, and disseminated intravascular coagulation early, emerging several hours to less than 20 hours after onset of heat stroke. People deteriorate quickly and the fatality rate is extremely high. That's exertional heat stroke. Now, classic heat stroke is a little different. It's seen in elderly, frail, and chronically ill people, and the onset is more gradual. Prodromal symptoms are difficult to identify. As symptoms become more serious across a day or two, blurred consciousness, delirium, and loss of consciousness can occur. Incontinence and high body temperature up to 40 to 42 degrees may appear. Heart failure and renal failure may occur. So this compares exertional heat stroke with classic heat stroke. And in the context of the Sundance, we're mostly dealing with exertional heat stroke. These are healthy people. They're young people. They're dancing. They're sufficiently hydrated that they're no longer sweating. Their blood pressure drops. And we want to prevent them from going so far as to enter into DIC or rhabdomyolysis or acute renal failure or lactic acid acidosis or hypocalcemia. Now, in modern times, we also could see classic heat stroke because we have middle-aged to elderly people dancing with pre-existing cardiac or renal disease, including diabetes. They're still dancing, they're still not sweating, they may be having low blood pressure, and they may be getting into trouble more quickly than healthy younger people. So, this concludes the slides. Let me go back to the first slide. And so I want to summarize. It is possible to see adverse effects of heat in the inipikaga, predominantly among people with diabetes or pre-existing heart disease or kidney disease. And we need to be cognizant of that. And sometimes, and most elders are, and modify the lodge, modify the inipikaga experience to accommodate people with these kinds of pre-existing conditions. I've not seen healthy young people have any problems, especially with the cooling down that occurs with the opening of the doors each round, and with the drinking of water and medicine after the second round. It seems unlikely that healthy young people will experience any kind of difficulty. Now, in the Hambletia, one is not exercising. It's not like Sundance. There's no dancing going on. And so it's easier to bear, it's easier to tolerate decreased hydration because of the lack of exercise. Nevertheless, during hot or cold days, there remains an increased risk for people with pre-existing conditions of heart disease, kidney disease, and diabetes that need to be considered. And of course, for Sundance, we need to be aware of the risk of heat exhaustion and heat stroke, which is increased among people with heart disease, kidney disease, and diabetes. And elders and helpers typically are, and typically do what needs to be done to protect the dancers and to keep them dancing. But there are outlying sun dances, and there are outlying people, and therefore continued dialogue in these areas will be useful because of the potential negative consequences of mortality upon ceremony, and therefore our desire to avoid it, lest government get involved in our business, which we don't want. So that's the presentation for today, and I will appreciate feedback from any arena. Our next session 5 will be on the Sundance itself, and I will look forward to encountering some of you there. Thank you for listening.